Hey everybody, you're watching A Physio Named Jonah. That's this guy. Today, we're going to be tackling a question that I get asked a lot while working as a physical therapist. Arthritis is a very common condition that most of us will experience to some degree in our lifetime. Now, when working with patients with osteoarthritis, a common question tends to come to the surface. This question often goes something to the effect of, should I stop because of my arthritis, or is it safe to keep doing with my arthritis? The answer to this question may surprise you, and in this video I'll share with you why the answer to this question is so important to know if you have arthritis. If you are new around here, consider subscribing to the channel and hitting the bell so you are notified when I release new videos just like this one. I'm a Canadian physiotherapist who makes YouTube videos on physio-related topics like exercise, medical conditions, so if learning more about your body and how it moves is interesting to you, want to hang out here on the channel. We'll have fun. First off, what is arthritis? Well, that is a question that I have done a whole video about before, so if you do not know what arthritis is, I do recommend checking that video out first for some context, but I'll also give a quick description of the condition right here. Osteoarthritis is the most common type of arthritis that I work with as a physical therapist. Now, the arthritis family has many inflammatory conditions within it, such as rheumatoid arthritis, but the most common type of arthritis that most of us are talking about when we refer to it in pop culture is the joint wear and tear breakdown known as osteoarthritis. Osteoarthritis is a condition affecting bones at the intersections where they come together, known as joints. The condition involves a breakdown of the mechanical structure of the joint, involving decreased joint space, a roughening and unevening of the surfaces with bumped called osteophytes, as well as overall reduced function. Generally, this reduced function is due to joint stiffness as well as pain or discomfort. Given how scary that description can sound, with a lot of big intimidating words and images that go with it, as well as the overall catastrophizing and fear culture that we have in our society around arthritis, it's really not surprising to me that so many patients ask me if they have to stop doing something that they care about because they have the dreaded arthritis. Here's where we start to flip the narrative in this video. Just because you have arthritis does not mean that you have to stop most forms of activity or exercise. In fact, exercise is one of the most important things that you can be doing if you have arthritis. Hey, note to self when I'm editing this later, if you could add like a clip, like an explosion clip over my head when I go, and maybe like an explosion sound effect, I think that would look pretty cool. So add that in. Exercise is absolutely crucial when it comes to managing osteoarthritis. It can help us lubricate joints to improve our range of motion. It can help us build muscular strength to better support our joints during movement, as well as all of the additional wonderful benefits that exercise has for our overall health and well-being. Your body is not this delicate thing that needs to be protected, and exercise is very likely not unsafe for you just because you have arthritis. This is not to say, though, that just because exercise is really important for arthritis, that arthritis necessarily makes exercise easier. Arthritis can pose a challenge when it comes to certain exercises because of available range of motion or joint movement, joint stiffness, pain, dysfunction. There can be a number of things with arthritis that can make certain forms of exercise more difficult. This is where, and I do recognize my bias on this one, working with a healthcare professional who can learn to know you and assess you can be really, really helpful for your arthritis. Learning how to modify certain exercises, maybe warm up for an exercise, build some strength in a certain area to support your joint, can be really helpful to managing your arthritis while doing more exercise as a part of your management. I really want you to leave today's video with this message, that exercise is not something that is unsafe for you or unattainable because of your arthritis. You are absolutely safe to move and exercise with a diagnosis of arthritis. In fact, it's one of the best things you can do to manage your arthritis. If you are struggling to begin or maintain an exercise routine because of your osteoarthritis, I strongly recommend working with a healthcare provider who can get to know you and help you create a positive movement routine that can make your arthritis better because of the movements that you're doing. Your future and your health are absolutely worth this. if arthritis is holding you back from your moving, I strongly recommend working with someone. If you have made it to this point in the video, thank you guys so much for watching. I hope that you learned something new today and feel more confident to begin moving if you do have arthritis. If you have any questions for me, feel free to drop them in the comments section down below. I do my best to respond within a couple days, so I look forward to chatting with you there. But most importantly though, guys, as always, move your body, have a laugh today, and I will see you at the next video.